Hello everyone, I am Dr. Prachee Kulkarni, Fertility Specialist, Ferty9 Fertility Center, Banjara Hills. So sometimes we get queries regarding what is PGT, where it is advised and for which patients it will be useful if they opt for PGT. So first of all, what is the full form of PGT? So full form of PGT is pre-implantation genetic testing. So what do we do is before the embryo is implanted, it is tested for genetic conditions and we transfer only genetically normal embryo. So this is what is PGT actually is for. So how do we do it? We do a normal IVF process. After the IVF process is completed, we have to see how many good grade blastocyst stage embryos the patient has. So these blastocyst stage embryos, what we do is we take the biopsy of some of the cells from this embryo. So these cells are then cultured in the genetic lab. After the culture is complete, they will separate the DNA from the cells. This DNA is then tested for genetic conditions. So once we know that embryos cells are tested as negative for any genetic condition, we select that particular embryo for embryo transfer. So what we have to do is do an IVF process. Once we have the good grade day 5, day 6 blastocyst embryo, we take the biopsy. We freeze the embryos until we get the report of this biopsy in hand. Once that report has come, we select the normal embryo out of these biopsied embryos for the embryo transfer. We prepare the uterus of the lady with the medicines. Once the uterus is ready, we thaw this embryo which we have selected as a normal embryo and we put back that embryo into the uterus. So this also helps in increasing the chances of implantation and also increases your chances of having a genetically normal child. So what are different types of PGT and which patients we advise to go for PGT? So there are 3 types of PGT. One is PGT-A, which is pre-implantation genetic testing for aneuploidy. This is the most commonly used PGT. Second one is PGT-M, which is pre-implantation genetic testing for monogenic disorders. So this test is used for couples who have a family history of a particular genetic condition which is happening because of single gene problem. So this is PGT-M. Then third type of PGT is PGT-SR, pre-implantation genetic testing for structural rearrangement. So this PGT-SR is done for couples who are carrier of balanced translocation in their karyotype, like either the husband or the wife is having a balanced translocation in their karyotype. So such couples we advise to go for PGT-SR. So now coming back to PGT-A and what is the indication for PGT-A. PGT-A is pre-implantation genetic testing for aneuploidies. So what are aneuploidies? Aneuploidies is having abnormal number of chromosomes in the embryo. So abnormal number means what? First let us see what is the normal number. So normal number is 46. So each of us have 46 number of chromosomes in all our body cells except egg and sperms. So egg and sperm will have half the number, 23. So when they combine together, again the number is maintained, which is 46. So 46 is called as euploid. U is normal. So euploid is a normal number of chromosome which is 46 for all the human beings. So 46 number is the euploid number. So any number which is less like 45 or more like 47, 49. So this is called as aneuploidy. So this abnormal number of chromosome can lead to certain genetic conditions like 45X0 is known as Turner's syndrome. So this number is less, one X chromosome is missing. So this leads to Turner's syndrome. So like that there are different syndromes which happen because of having either less number of chromosome or having more number of chromosome. So this can happen with either one chromosome or can happen with multiple chromosomes. Suppose if it is happening with chromosome number 21. So what we see is instead of 2 copies of this chromosome, we see 21 chromosome being represented as 3 copies. So we call it as trisomy 21. So which is Down syndrome. So we are all aware of Down syndrome. There might be multiple issues with the babies having Down syndrome, like there might be intellectual deficiency, there might be thyroid issue, there might be an increased risk of having certain cancers like leukemia in such patients. So we don't want to conceive a genetically abnormal baby. So what we do is we advise these PGT tests to women who are higher age when they are planning to conceive. So especially for the women who are more than 35 years of age. So this is the first indication of PGT-A, that a lady's age which is more than 35 years at the time of pregnancy. So such patients who are undergoing an IVF cycle after 35, we give them an option of going for a PGT-A. So how this helps is, also we can select the embryo which is normal, and you will have a genetically normal baby. Also it reduces the time to pregnancy. Means if I know that this particular embryo, which is third embryo, which is normal, then I will not transfer abnormal embryos, which might be the first embryo and second embryo might be abnormal for that lady. Then I will directly select this embryo for transfer, and it reduces the time for pregnancy. If I am not aware of this, then I might be transferring the first embryo, which might be genetically abnormal, and it will either result in implantation failure, means you will not conceive, or you may end up with a miscarriage. So we avoid this miscarriages, or we avoid having a failed implantation by directly selecting the embryo which is genetically normal. So reducing the time to pregnancy, also increasing the chances of having genetically normal baby. So for women who are above 35 years of age and who are going for IVF treatment, this is an option. Also we advise to go for PGT-A to patients who have history of either recurrent pregnancy loss, that is miscarriages, or also the history of recurrent implantation failure. Like as I already told you, this can be a reason for embryo not getting implanted because the embryo is aneuploid or genetically abnormal. So for such patients who have had IVF failures, who have failed to implant a non-PGT embryo or non-tested embryo, such patients we advise to undergo a PGT in IVF, so that we can select a euploid embryo to increase your chances of having a successful IVF. So second indication is having recurrent implantation failure. Also to patients who are having recurrent miscarriages. So as this can be a cause for miscarriage, we advise patients to undergo first genetic testing for themselves, like karyotype. If they are related to each other, like if you are married to your cousins, then we may advise going for further testing in case if you have recurrent miscarriages, like either going for whole exome sequencing or extended carrier screening, because certain genetic conditions which are recessive genetic condition, which you may both may be carrier because you are sharing the same genetic pool from the same family. So you may be the carrier of these conditions which are autosomal recessive, but you don't have the disease. So you will be as a like normal person, you may not have any symptoms of that disease, but you are a carrier of that. So we will know that carrier status of autosomal recessive conditions in this genetic test, which is called as expanded carrier screening or whole exome sequencing. And if you both test positive for a particular condition, then we do a pre-PGT-M analysis and we advise you to go for PGT-M along with PGT-A. So these patients who have recurrent miscarriages, they either may benefit only from PGT-A, or if they are carriers of certain genetic conditions, they may require PGT-M in addition to PGT-A. So these are the couples which will benefit with PGT-A. So now as I already mentioned PGT-M, so these recurrent miscarriage couples, if they are carrier of same genetic condition, then we advise to undergo PGT-M to such couples. Also we advise PGT-M to couples who have a family history of a genetic condition which is carried by a single gene disorder, like thalassemia, cystic fibrosis, or spinomuscular atrophy. So these conditions are genetic conditions which happen because of single gene problem. So then what we do is we do an IVF process, take the biopsy of the embryo, we take the samples from the affected family members of the couple to make a template of which gene we are going to test on the embryo. So it is called as pre-PGTM analysis. So we need couple's blood sample, we need affected family members' blood sample for this pre-PGTM analysis. Once the templates are made, these templates are then tested on the embryos for PGTM. So it's little longer process than PGTA because we need blood samples even to make the templates, which may take 4 weeks to 6 weeks time. But once your embryos are ready and frozen, there is no hurry. We also freeze the biopsy. So once we have all the analysis ready along with the templates, then we check these cells which we have biopsied from the embryo to look for that particular gene, and the embryo which comes clear of this genetic condition, that is PGTM normal embryo, we can select for transfer in IVF. So this is about PGTM. Now coming to PGT-SR. So PGT-SR is advised to couples who usually represent either with infertility or with recurrent miscarriages. And when we do the genetic analysis of the couple, which is a karyotype test, we see that either of them are actually having balanced chromosomal translocation. What is translocation? A chromosome has a structure wherein a part of chromosome gets inverted or gets attached to a different chromosome. So for that particular person who apparently is having a normal life or appearing as a normal person, but actually the chromosomes are having this issue of one segment getting attached to the another chromosome, but that particular rearrangement has been balanced because all the genetic material is present for that person. So what happens when such person is forming gametes, like as we saw, each cell has 46 chromosomes, but the gametes like egg and sperm have 23 number. So this cell division happens. Suppose if we consider is the male who is having this translocation. So this particular male, when the cells are getting divided in the testes to form the sperms, this balanced translocation may result into an unbalanced way of transferring the genetic material into the sperms, and now this unbalanced genetic material in the sperm, when it combines with a normal egg also, will result into again unbalanced genetic material in the embryo. So there is a chance of this person having some sperms with normal genetic material or balanced material, some sperms with unbalanced. So we cannot detect or test each and every sperm, and we cannot make the embryos if we are testing the sperm. So what we do is we make the embryos with the sperms, and then we test the embryos to look for which embryo is having a balanced material or which having is unbalanced genetic material, which is having a normal genetic material. So once we get the embryo with normal genetic material, we use that particular embryo for transfer in such patients who were previously struggling either with infertility or with recurrent miscarriages because of one of the partner, like either husband or wife, having this translocation in their own karyotype. So this is about PGT-SR. I hope this was helpful. We at Ferty9 Fertility Center, we do all these PGT tests on the embryos. So if you are suffering from recurrent implantation failure, or if you are having like IVF failures, or you are having recurrent miscarriages, then you can consult me. I'm Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Thank you.